1 week ago, we were celebrating the first day of in-person instruction for 36,000 students. It was a great day then, and it's a great day now. We began the year and welcomed back more than our 36,000 for in-person learning. That was a commitment that we made to our students, to our families, and to our community. We worked very hard to make sure that things were right and in good shape for that day and for today. As we prepared for opening day, we knew we would have COVID infections, and we knew that we would have quarantines. The surprising thing was that last year, we hosted about 12,000 students during a hybrid experience, and we had very few cases. Students wore masks. They kept their hands clean. Our district, of course, provided engaged all of the strategies that we knew worked, and we followed the science. We knew, however, upon the advent of the vaccine being available, we kept watching our community, and we are aware that that low vaccination rate and the surge of the Delta variant would create some additional challenges for us. But we plowed ahead. We stayed focused on making sure that we were able to open last week. Yesterday, as we did last year, we posted our numbers. Were we surprised by them? Not really. Were they what we wanted? For sure, they were not what we wanted. But we knew upon introducing 36,000 individuals into about 55 buildings that there would be a possibility, especially after summer vacations and lots of public activity, that we may see a greater number of persons who were infected. I almost chuckled when someone in the community said to me, "How is it that you had infections on the first day of school?" Because people have been living their lives and they've been engaging all over this community. And of course outside the community. Lots of people have been on vacation, and lots of people have not been as attentive to the strategies that we know help keep us safe. But what we are doing is making sure that we are staying the course, and we are prepared to do what we've always been prepared to do, and that is to pivot. You'll remember that just prior to school opening, our first thought was we would be mask optional. As those numbers started to climb, we knew it was safer for our students and for our staff to have a mask requirement. And you know what? Surprisingly, we've had very little pushback because our students and our families and our staff know that our job is to make sure that they are as safe as possible. So we are engaging in using all of the mitigation strategies that we know help keep the environment safe. And while I was not pleased with the numbers yesterday, they're not surprising. In fact, for a school community of almost 37,000, and that's where we are, close to 37,000, to have 1,000 students, more than 1,000 students in quarantine, represents about 3% of our student population. 3% more than I like, but that means I have 97% who are doing very well at this point. We want to increase that number, of course, and while our students are in quarantine, we have a very solid plan for making sure that they stay engaged with instruction. You know, the early onset of the pandemic taught us a lot. It gave us the tools that we needed to ensure that our students could still engage with instruction while they are in quarantine. And of course, we are very grateful for the number of parents in our community who've made a decision, when possible and when eligible, to have their students vaccinated. We're excited about that, and we do hope that others will join. But I will say this to you, as I've said to our families last week. We have a COVID response team in every building. We have a district COVID response team. We also have the support of many of our medical professionals in our community who help us to serve our families and our staff well. It is important for families and for staff to remember that one of the main mitigation strategies is not to report to school or work if you are not feeling well. And if you have the inclination to be tested, if you're waiting for test results, if someone in your home has tested positive, please do not report to the work site or to the schoolroom. We have a process to ensure that the students and staff stay engaged, but we do not find it useful, we do not find it helpful for students to report to school when they knowingly are infected or are possibly waiting for test results. It's going to take all of us to get through this time. Excuse me. It's going to take all of us to get through this time. We'll do it by working together as we have done, and we expect that we'll have a lot of cooperation in that effort. Our plan was successfully executed last week, a week ago. We plan to keep the doors open, but we're going to need everyone's support in getting that done. Internally and externally, we need everyone to make sure that it happens. We will do everything within our power to ensure that our buildings, that our activities are safe. We will continue to follow the guidance issued by the Centers for Disease Prevention and Control. We will continue to follow the guidance that is provided by our Department of Public Health. We watch the numbers and we have seen them growing. It is astounding what position we're in with our community transmission rate, but we will continue to try to serve our children. Today, we have 3% who are in quarantine. Our hope is that those numbers are fewer for coming weeks. But whatever the numbers are, we're prepared to serve our children. And our intention is to ensure that everyone knows that we support and encourage using all the protective measures that we are acquainted with. And that means that we're encouraging staff, adults, and eligible students to get the vaccine. While we recognize it's a personal decision, I think it's much like anything else that we do to protect ourselves, and that's what we would like to do. Should you have forgotten much of the work that we've done to ensure that we have a safe environment, Mrs. Miller-Kegler will share with you, or just do a quick review of some of the strategies that we are currently using. Again, I want to take this opportunity to thank our COVID response teams, both at the school level and the district level. Mrs. Wilson, our lead nurse, is here. We have a great group of people who are working tirelessly day and night to ensure that we are notifying and talking with parents and our staff who may be infected or may have recently gotten tests, or maybe even encouraging people to get tests if they're not feeling well. So we are grateful for their service, which of course is above and beyond anything that we ever expected we would be able to do. But I will tell you that we are indeed ready, and we are able to serve our children well, and we'll just need our community support in getting that done.